formally. Hi, Moreno. Thank you for joining us. It was a pleasure meeting you again. It has been what 10, 15 days since we last met. And it is, a great experience. I think you had a relaxing couple of days to rest after Pharma USA, I guess.
I did. I was on PTO with family and it's still showing a bit. So it was very nice. And I'm very
Oh,
happy that we had the
nice.
chance to talk again.
Thank you. Thank you for another once again. Thank you for agreeing to talk to me again. We met. So a little bit of background for our audience. So I'll just give a quick recap to all of our audience. So for everyone, me and Morano we meet during Pharma USA in Philadelphia last week in March end. So and I had a pleasure of attending his session where he was part of the panel. They discussed about the topic of internal and external role of internal and external stakeholders and partnerships, to make it more patient centric approach for the pharma industry. It was really overwhelming for me because I'm also a service provider, an external partnership or an external consultant. So it was overwhelming to see that how open the thoughts are about uh, uh, about the external partnerships to help and to mitigate and touch the life of patients. So and that was it. And after that conversation, me and Morano connected for 15 minutes. He was going for a meeting. I catched him off guard and for a meeting, and he was very generous enough to give me 15 minutes of his time. At that point of time, I have already posted a snippet of that interview on my LinkedIn, and we'll be always obviously putting that again on this conversation and also. So thank you once again. Today we are going to have a little more extensive conversation. So without further ado, I think I've taken enough time. So without further, I'll start with a couple of very basic questions and a couple of very very basic discussion. Very quickly, firstly, I want to understand once again from directly from you. I wanted to understand and would like our audience also to listen what your viewpoints are about internal partnerships. What do you mean by internal partnerships and what do you mean by external partnerships, which can bridge the gap between the pharma company and the patients basically, so that the engagement is better. So over to you, Maran.
Thank you so much, Manchu. And again, thank you again for the opportunity today to talk again. A couple of points, I guess. Let me go a 10 seconds digression as a background of what I'm doing, I guess. And so I'm going to give you a background on where I'm coming from. I'm currently the president for the pharmaceutical division, active and medical nutrition for Nestle Science. It's a company owned by Nestle. And by nature, our portfolio spans from hardcore pharmaceuticals to a consumer care product, to active lifestyle products that have a different regulation. So we really look at the patient and the consumer as one. That's the vision of what we have here. We don't see conflict, but actually we see an opportunity of getting together and cover products and making an impact on the health of the patient if he has a disease, or the consumer before he even become a patient, because we all are patient for something and consumer for something else. I think that it's a key component to keep in mind, Himanshu, as I'm answering your question. I truly believe that in pharma for several years, we have been over-dissecting, over-focusing on treating a patient for the disease, but not looking at the big picture of what we need. A cancer patient has cancer, unfortunately, but also a lot of other needs that go beyond treating cancer, but maybe treating their the ability to taste flavors, the ability to maintain the right weight. So that is really where we think in Nestle Science, those two domains of consumer and pharma get together, merge together, and we are able to deliver successfully to the patient. Specifically, we're looking at an array of services for our patient on the pharma side that enable them to be on therapy, to remain being adherent, to get easier access to the product, as well as looking at additional needs they might have beyond just getting well from the disease. We launched a product. The product is called VOWST, VOWST. It's the first oral microbiome technology available in the US, and I guess the first also worldwide, as a matter of fact, even if it's not available in other geographies at this point in time, for the recurrence of Clostridium difficile. We had a very successful uptake. We are very happy with the uptake. And we learned that the market out there, it's ready. We talk to doctors, and doctors are telling us that patients more and more come with opinions, with a diagnosis. I do it, you do it. I remember when we met in Philadelphia. So that dynamic is something that we've been looking at as we continue creating awareness with HCP and patients on how to treat that disease and how to keep our healthy lifestyle. On the internal part, we do believe that there is an opportunity of tearing down silos that otherwise are very common in pharma, if you allow me to say, Himanshu. In pharma, there is so much of R&D versus commercial, but the reality is that while R&D has a strong responsibility in ensuring successful negotiation with the FDAs, with anyone that is going to be looking at clinical evidence, and it's important that that component remains as independent as possible, not only because of regulation and compliance, but also because it is a different job. Nevertheless, Himanshu, we do believe in Nestle science that the sooner we are able to bring into the discussion commercial mindset, the better is going to be the output. This is less about commercial having a saying on R&D, but rather R&D being able to deliver evidence that is also meaningful beyond doctors and HCPs and the FDA. There is a need of having evidence that speaks to a broader audience, making it payers, decision-making, patients, right? As we said. So we really have been working, and that's the approach we use here, in tearing down those silos and working together and having good, healthy contamination of mindset and goals as we're working.
Very nicely put. Very nicely put about the contamination. I'm going to ask you about Wowist also. So before we do that, so there is a big mindset about Nestle. So because everyone knows about Nestle being being a nutraceutical, being a FMCG company, very few people know about Nestle being a pharma company as well. So, so how did it start? Can you give us a little bit of a history about the, when did it start? How did it start? Was it an organic, development within the Nestle, or was it something inorganic where, Nestle acquired some organization and brought in the pharma business? So a little bit of a history with a little bit of, timeline kind of thing would be great to know.
Very happy to, and thank you for the opportunity once again of explaining it. Indeed, everyone knows Nestle for the food and wellness piece, but clearly the company is much more than that. So let me start from the beginning. I believe that the company always had a strong root in science because of our medical nutrition portfolios, what I guess you might refer to as nutraceutical somehow, but we do have a very healthy, well-established business in medical nutrition. Medical nutrition is regulated by FDA, EMA, with a different chapter than drugs, but more than what will be regular food. And these are products that are meant to be used under medical supervision, where you have claims that they need to be regulated. So really halfway between food and pharma. Building of that successful business and relationship with HCP, healthcare professionals, nurses, and our patient. A few years ago, Nestlé started thinking, we actually could expand and bring even more value by looking also at the opportunity of catering pharmaceutical products to our patients. That journey started, I would say, around 2015, 2016, when we had the first deal with Series Pharmaceuticals. They are a company based in Massachusetts, and we did since then several deals with them. We'll be looking at other company. The first product commercially available coming our way has been in 2020, when Allergan was bought by AbbVie, and there was a need of for them to reconsider part of their portfolio. We made the pitch. We have been very successful, I guess, in showing our love for the product. I was part of that team, I mentioned. I really believe it was a wonderful addition to our portfolio. So in 2020, we acquired rights for a product called Zenpep, Z-E-N-P-E-P. It is for exocrine pancreatic insufficiency. The product coming from Allergan has been in the market for quite some time, very well established. The same year, we also completed the acquisition of Immune, that is a broader company in the allergy space. And then for food allergy, the first product in the market is called Palforzia, and it's for peanut allergy. And then in 2023 came to fruition the launch of Vaust. That is actually the partnership that started in 2016-17 with Series, but came to fruition given the approval from FDA in April, and then the subsequent launch in late May of 2023, Vaust, that is the product for recurrent Clostridium difficile. Since then, we have been successfully enjoying very good performance and I guess feedback from the patient and the community, the scientific community of our gastrointestinal portfolio. In 2023, we also made the decision of moving out of the food allergy pharma portfolio. We remain with a strong food allergy product portfolio, for patients with food allergy in our medical nutrition and consumer care, but not in the pharma. So that's a long answer, I guess, to say in 2024, our focus of our pharma division is in gastrointestinal with two products and hopefully more to come. One is for EPI and the other one is for recurrent Clostridium difficile.
So, lovely to know about the history. And obviously, it clearly, the way you have said it, it clearly shows this, that, what you have spoken about, the internal external partnership, because, you, again, coming back, I'm circling back to the same topic, and I can completely relate because you have spoken to doctors. You have taken feedback. So, a bit of a market research has been done and market assessment has been done to see what is going right for Nestle and what is probably you want to do for the future. So in the decision making, so that's completely sinking in what you spoke about. Now, actually, you have quite a bit answered something which I had in mind, but I still ask this question. Would love to know about the deal with Ceres, about Wowist. A little bit of a deep dive into the technology, if you can, and how it works, and when I talk about deals, so what was the deal size like? I know it was in 2020, 2016. What was the deal size like that from point of time? Does it involve more molecules beyond Wowist? And where do you see, I mean, and what about the global rights and so on and so forth? So whatever you think you can answer, I would love to know that.
Very happy to answer. A lot of points in your question. So let me go through most of them. And if I'm missing anything, you remind me, okay? So first of all, we have been growing by acquisitions and deals, clearly, because we did not have to start with a pharma presence. The numbers on the deals are public. So I guess I can articulate them. You can find them We have today a full-fledged pharma structure that goes from commercial deployment with 150 GI reps and 20 hospital reps. We have a regulatory team, we have a market access team, we have all the must-have to have a commercial rollout for in the GI space, we think successfully for those products and more. We also have in-house a strong R&D network and team. I mean, part of them are sitting in the US, part of them are sitting in Switzerland, where our headquarters are. Regarding the deals and the structure, the deal with Seres that started in 2016-17 as a first deal was initially focused on the rights outside the US, and then in the following year also expanded in the US. So we have a commercialization agreement, a co-commercialization agreement with Seres worldwide. We are very happy of that partnership, and we keep on working with them to advance the opportunity for VOWST. They have been developing the product. That's the expertise we're bringing to the table, and we took more active role when it came to the actual commercialization somehow. But again, it's a co-commercialization. We are working together very well. We have been with them through the good time as it is today. We've been with them through hard time. As a reminder, how difficult is always to develop a product. There was a phase 2 study, it didn't come true, right? It happens all the time, unfortunately. Yeah. We also believe that it's part of pioneering good science and in pioneering science in the microbiome space, which is something that we talk a lot, but also kind of new, right? It is a complex beast to deal with. Exactly. We believe a huge opportunity, Mancio, in terms of what the benefit can bring even beyond the current product. Today, VOWST is commercialized in the US since May with the FDA approval and early June 2023 in terms of actual availability of the product. It is indicated for recurrent Clostridium difficile. It is an oral microbiome technology, 4 pills for 3 days, 4 pills, day 1, day 2, and day 3. And we are receiving very good feedback from the community. I was telling you, we're very pleased with the uptake. We thought at the beginning, Himanshu, that he would have been needed much more medical education to talk about microbiome. We thought that it is so new, right? The topic somehow, that we needed to invest much more time in explaining to doctors what the microbiota is, how to deal with that, how this product works. One of the key lessons learned of the last 7 months, looking back at the fast success of 7-10 months, has been that doctors are ready. The reality is that the main question from doctors is, okay, can you show me the data? Which I think it's a fair question, and we do in a compliant way. They are very pleased with the efficacy data that is almost at 90%, and actually potentially even higher in subsequent studies. The safety profile they're very happy with. And we saw indeed that the community is ready to take on new technologies. Do we receive questions on how the product is sourced? The answer is yes. We thought that there was any concern. I mean, without going too much in details, unless you want me to go to the alternative is something called fecal microbiota transplantation, which it's not standardized and technically not approved or regulated by the FDA. So it brings some concerns related to, I guess, the ability to replicate on top of the challenge of being commercially available. And then another product launched around the same time. It is called Rebiota from Ferring, having a different profile. And that product is an enema. So we do have the advantage of being an oral product with different clinical data. So we are very excited about the other opportunity. Sorry.
No, it is an exciting molecule. I read this news when it was launched, And it was very fascinating. I have been tracking microbiota for a very long time earlier when I was working in oncology. So I used to track. There were a lot of research paper being published in ASCO, presented at ASCO and AACR as well. So since that time, I think 2016, 17, I have been tracking for oncology use. So it is a very fascinating field for sure. Now, one question which was left that within this part of the question was any more molecules upcoming from the from Ceres Biodee for Ceres Teak basically?
So we continue partnering with them and
Mhm.
trying to see what is the next advancement in the space.
Okay.
This could be as life cycle management, for lack of better language, within VOWST or any new different molecule. The agreement is very complex, speaks specifically for VOWST or for the technology behind. And again, we continue talking and scouting the market, even beyond, as a matter of fact, the partnership with Series in what is the next things. We did make public a few months ago by now an additional development deal that we did with a company called Codexis. This is for hopefully successful development of a synthetic pancreatic enzyme. And this is going to still take a few years to develop, but Himanshu, I guess that we continue being, we were even before creating the pharma division, a company deeply rooted in science. And that is true to our roots, regardless it's pharma, consumer care, medical nutrition. In pharma, that is even more true because that's the way you go about advancing pharmaceutical products. And we continue scouting the market for additional molecules. So I guess more to come, my friend. I believe that there is a big opportunity in the enzyme space, nothing new there, I guess, in terms of surprising, I would say. Clearly, the opportunity in the microbiome space, it's massive, right? As you said, I guess, in a comment earlier, there is hints or there is signs, maybe that's the right way of talking about that. There is a case reports of potential successful opportunity in cancer, in diabetes. I mean, again, across so many domains that
Exactly.
it's really exciting. I feel like a kid, a kid at the ice cream parlor and just being overwhelmed from all the different opportunities. And what is the next flavor to look at? So I think we're going to be pleasantly surprised with what's to come from the space.
So, okay, quickly, I'll give you a few choices, a little bit of a rapid fire, just two, three questions. So, Prasanna, uh, microbiome, small molecule, or biologics for future?
I believe that, so today our portfolio really looks at biologics, but the reality is that I believe that to the extent a product fits our gastrointestinal portfolio and focus, and we believe that the science is strong and there is patient and consumer unmet need, I think that we look at this in the same way.
Awesome. Okay, then our next question would be oncology, neurology, gastro. Which one would you choose? I mean, if you given a choice, where would you like to take it? I mean, pick, Nestle in which direction? And it could be beyond these three choices also. One
So
therapy area.
let me tell you, I know the answer. That's a good part I mentioned. So
Awesome.
in pharma, the answer is very clear. It's going to be gastrointestinal. Now, with our broader portfolio that I'm responsible for in medical nutrition and in the life and active medical nutrition component, I think that is already way beyond gastrointestinal. We're already playing in oncology. We're already playing in a lot of other domains. But for pharma, the answer is gastrointestinal.
So anyone out there with a GI product basically in early stages should contact you for a deal. That's what you're hinting towards.
I think we are happy to talk. We are very happy to talk, and we are happy to share our expertise and always to learn, to be clear, but also
Definitely,
to share our
definitely. And
expertise.
you
Go
have a
ahead.
very strong commercial team now. You've established yourself as a good GI company in terms of pharma medicine. So definitely there is a lot of scope there for sure, and expertise also.
As you said, we are very happy to talk and to learn and to put on the table our commercial expertise, but also our, going back to your comment at the beginning, our holistic understanding of the patient and the consumer. I really believe, Himanshu, that that is key. Looking at patients as consumers and really being able to see the entirety of each and every of us and not dissecting the disease versus the rest, because we're still one human being. We are very happy to put that on the table as well.
Okay. So last question before I actually ask the last question. Second choice, second therapy area. GI, you have said second therapy area. Which fascinates you? It could be that Nestle might not be interested in, but something which fascinates you, maybe.
That's a good question. There is not a company position on should there be a second therapeutic area that we look at. Historically, we have been looking at the um, food allergy, and I guess you know how we have been evolving that. I believe that a second therapeutic area is something that we still want to be closer to our strong focus on nutrition somehow, and that will be
Okay.
the link to go about it. Where with GI, it's kind of closer by nature and
Yeah.
mechanics behind. So any disease state where nutrition can play an important role, I really believe that that will be a second therapeutic area to look at. Even if I've been very clear today, the focus is in GI.
No, I get it, and thank you for being so candid. Okay, so literally last question. What does Moreno like to do in his free time? When you are not working, when you're not attending meetings, when you're not traveling for the work, what do you like to do? Just lay back on the couch, watch Netflix and chill, or spend time with family, or it could be something else.
Thank you for the question. That is unusual. I'm very happy to answer. So I do have a 3-year-old and a 1-year-old. So the time is, if I'm on the couch, there are 2 other guys jumping on me on the couch, right? On me while I'm on the couch. So it's really family time, enjoying every minute of it. Given that I've been around on the industry for like 25 years by now, I also like a lot to provide advice. I really believe that more and more, Himanshu, we are told to play an active role on how we shape the world around us. And it's not only ethically correct, but it's also extremely rewarding. So I do a lot of pro bono, consultation, or anyhow, giving advice, guidance for anyone that wants to listen to it. But more and more, that plays an important role. And that can take shape across different things. Can be on folks reaching out to get some feedback, to provide ideas on how to have a more active engagement in the village where I live, close to Chicago, and taking it from there.
So on the last point, I'm gonna take you up on this for sure. Sometime let's connect separately and talk about I'm a budding and entrepreneur. You have been a pioneer in the field, so would love to know your thoughts of what I'm doing right and what I'm doing wrong, and how can I improve. I'm gonna definitely take you up on that, and I'm not gonna take no for an answer for sure.
I'm very happy to, honestly. I think that's something very important for each and any of us, especially in the US, Himanshu. The healthcare system is changing so much and so rapidly that
Mhm.
I believe each and any of us has a ethical responsibility in the field to play our role to make it evolve in a way that it's sustainable and that it's fair.
Yeah. So just on a last note, I can relate to the statement you said, sitting on a couch and 2 people are jumping on you. I can relate to it because I have a 4-year-old. So similar thing
There
happens with
you go.
me.
You know what this is about. And I guess a lot of folks,
And
when listen to this, will say, I remember those times. And what I'm seeing more and more in Manchester, folks saying, I'm also very happy that it's not happening anymore, right? Where the kids get a bit older, but I've been told bigger kids, bigger problems. So let's just enjoy it while there's still small problems.
Definitely, yes. So lastly, thank you, Moreno, for your time. It was a really valuable discussion for me, definitely, and obviously for our audience as well. They're gonna learn a lot more about Nestle product, and the future of the Nestle Pharma division. So thanks again for your time. Um, and lovely meeting you. I think we should catch up one more time. Whenever you have time, we should catch up, maybe more milestone also. Thanks a lot.